At one time, children who were restless and fidgety, and we mean extremely restless and fidgety, were automatically just labeled problem children. And now it's known that a lot of these children suffer from attention deficit disorder, something very specific and concrete. And in part 2 of a wonderful series, MARIANNE Bannister examines new treatments for ADD. MARIANNE.
Thank you, Christine. Well, when a child has attention deficit disorder, it controls their every action and that of the family. All concern, all existence surrounds the child. And when violent behavior is involved, it can lead the family to the brink of disaster. Although medication can often help, it isn't always the answer. And that has led some families down the road of biofeedback. Sitting still is not something easily accomplished for 7-year-old Daniel Travis. Up until last spring, this behavior was more representative. Violent outbursts, mostly aimed at his brother and sister. Anger and sullen expressions. At one point, he even hit his head through a plaster wall. Poor grades and behavioral problems got him kicked out of school last spring. Daniel has attention deficit disorder, and it has nearly torn his family apart.
He was just abusive
To his other siblings?
Classmates, siblings, and people that would be around him. You didn't cross him. Daniel was a person you didn't cross. You didn't take away things because you would pay for it.
Dr. David Velkoff says, all in all, it's normal behavior for a child with ADD.
They operate on their own rules. They don't like rules. They don't listen. They can't follow directions. They're out of synchrony with the outside world. They're almost operating on their own standards.
The Travis family ruled out drug therapy and instead entered Daniel into the EEG brainwave feedback therapy program at the Drake Institute for Behavioral Medicine. That was last April. Within a few weeks, Daniel was a new boy. He's now calmer, follows instructions, and rarely has an emotional or violent outburst.
Just keep this going over the line.
Through electrodes attached to his skull, Daniel works to re-educate his brain waves to a more normal path, exercising them by way of a video game. He's working to keep that F-16 above the middle line.
In our treatment, they're getting treatment on normalizing brain functioning. And when they do it enough times, the brain begins to just re-normalize its patterns, and it works that way all the time without any more treatment. So it not only can reverse the disorder, which the drugs don't do, but it greatly enhances the child's self-esteem and self-confidence because they're performing as well as the other kids without medication any longer.
The EEG biofeedback treatment program has offered 16-year-old Scott Rutledge a future as well.
We came here after trying and exhausting all the chemical alternatives like Ritalin and dextroamphetamines even, and none of them worked. I mean, I lost like 50 pounds with one of them, and they just, nothing worked, and this seems to work, actually.
Indeed, after repeatedly flunking classes, Scott is turning in nothing but A's and B's in the first few weeks of the new school term. A far cry, his mother says, from the days when he hated to go to school.
We started him, and it's been a miracle, a miracle.
Researchers recently found ADD is not a condition that is outgrown, and it is plaguing many adults who don't even realize they have it. We'll have more on that for you tomorrow.
It's like Christine pointed out also, biofeedback is harmless.
It won't hurt the brain waves at all. You cannot hurt yourself going through this process. So for many people, the other avenues haven't worked. They're up to trying this, and it seems to be working for them.
And if it gets results.
Hey, exactly.
Who
Who cares how?
It was a wonderful success.